Trauma matters to education. When I think of trauma in schools, I think of students and families that come to school that have experienced things like homelessness, poverty, domestic violence, mental health issues.
And with students who are struggling with trauma and difficulty emotionally, consistency, predictability, and having a consistent environment is one of the integral parts of healing. This is Rue, and she is a therapy dog. As a guidance counselor, my purpose is to support students within the school, both academically and social emotionally. And then Rue is my sidekick, and she helps support those efforts as well. Students come to school with everything that they are carrying from home, from activities, from friendships outside. It all comes in. Trauma-informed care would be supporting students in the place that they are at. For me and for Rue, that would be providing care for students in their classrooms. Understanding the importance of predictability, consistency, relationships, and providing students with skills for coping and distress tolerance.
We jump in when there are kids destroying property, throwing things across the rooms, cussing at teachers, disrespectful behaviors. The internalizing kids, once they get to junior high and high school, they're the most risk for self-harm, eating disorders, suicide attempts, depression, a whole host of other issues. Sometimes aren't identified until it's almost too late. Trauma, what's difficult to wrap your head around is that it's not linear like if you were looking at math scores. Like ideally, if you're doing interventions right, your math grade is going to go up. Your competency in something is going to increase. With trauma, we could go up, down, all over the place because that's the nature of trauma.
And that Dan Siegel model of flipping your lid, so you have your thinking brain and you have your emotional reactive brain. And I think once we had the language to be able to see these behaviors in that way, it really helped make sense in the interventions that we were using, that before we had an understanding of trauma-informed care, we would ask, why did you do that? And we now know that they aren't able to answer that when they're here. Some of our interventions had a lot to do with language and problem solving and asking kids to use coping skills, which are up here in the higher learning brain. And instead, we know when they flip their lid that we just have to deal with that regulation piece. That understanding alone has made a huge difference. That, along with just the understanding of all kids are coming to school with a story. So when we say trauma-informed, we're being able to recognize that trauma is there and then give both teachers, students, and families an understanding of what trauma is, and then also provide some strategies on how to support those students and families that have been affected by trauma.
Trauma-informed means being aware of yourself and what you bring to the table and how your interactions with others leave a lasting impact on them. I've done a lot of trainings with teachers for trauma-informed care. I really push this self-awareness of you need to be aware of your own trauma to be able to help other people and to be able to develop the skills of compassion to work with people that have traumatic experiences. But lots of preventative work. We can do a lot of skill building. We can identify families early on and start making interventions. And sometimes if it takes 6 years, well, we've got 6 years with you in elementary school to work through these things.
Every student has a different map of resiliency and who they are. Rue and I's job is to help them identify that. And having Rue there as a non-judgmental buddy helps empower students, it helps them feel more confident, and it gives them an additional person or animal that they can count on when they go to school.
Trauma matters to education.
Trauma-informed care matters because our community matters.
You are part of the solution.
Trauma Matters Omaha.